Welcome to the Wellness Connection with Dr. McMinn. Dr. McMinn is Birmingham's wellness doctor, practicing cutting-edge, world-class wellness medicine at McMinn Clinic in Homewood, Alabama. Each week, Dr. McMinn interviews experts in the field of integrative wellness medicine. The Wellness Connection brings you the information you need to optimize your health in mind, body, and spirit. And now, here's Dr. McMinn.
And welcome back once again to the Wellness Connection with Dr. McMinn. We're back here with Misti Walraven, once again, our moderator, talking about heart disease today.
So if a patient goes to the doctor, they get their blood drawn, and they end up with a high C-reactive protein, what can they do?
Well, Misti, once again, lots of things you can do. There's not one drug or one pill that you can take as far as I know, but certainly maintaining ideal body weight. There's a direct correlation between obesity and inflammation. A good, what we call anti-inflammatory diet. And Misti, I think I've got that all written out. How about if we put that on the webpage? So somebody can come to that, or Facebook.
Facebook.
So Misti will put that up for you. I got that mainly from Dr. Andrew Weil. He's one of the folks I certainly look to for trusted information. If one had a lot of risk factors, for instance, they could take a baby aspirin. We talked about managing insulin and blood sugar, exercise, stress reduction. All those things can be helpful for inflammation.
And they can also do some herbal mix as far as supplements go in fish oil, like a therapeutic dose of fish oil.
Yeah, absolutely, Misti. I think there are a lot of things we can do for inflammation as far as supplements go.
Yeah.
And I must say that I don't think I can claim any of these are FDA approved for inflammation.
Right.
Although it's interesting to me, I think more and more you'll find even cardiologists getting on board with things like the fish oils. In fact, the major drug companies are as well. Like we have the Lavazza right now, which is a FDA approved fish oil. So you'll find, I think that's probably my number one is the fish oils, but you have to take a therapeutic dose. Just taking a 1 gram dose is probably not going to cut it as far as inflammation.
Yeah, so one fish oil pill is not going to work for you.
That may be okay for maintenance, but it's really not going to treat anything. To get a therapeutic dose, you need anywhere from 3 to 9 grams a day. I usually have my patients take about 5 to 6 grams
Somewhere
a day.
in the middle,
fish oils. That's right. That's right.
What about statin drugs?
Well, let me finish up on some other what we call nutraceuticals.
Okay.
I do think sometimes the herbs can be helpful. I particularly like the curcumin, the garlic, green tea. In fact, I remember something recently. Some UAB researchers were documenting how garlic can be helpful with heart disease. So
garlic
I think
is good for everything.
Oh, yeah, it's good for everything, isn't it? So I definitely like those. I like sometimes the enzymatic therapies can be helpful, and so. That's what I would do as far as the nutraceuticals. And so, I'm sorry, let me see, what was your next question?
What about statins? I just was kind of throwing that in there.
I think statins can definitely have some anti-inflammation effect. I'm not a big statin guy. I think there is a time and a place for them. I think they're wonderful drugs. They've saved many lives. But I think sometimes we're a little bit quick to use those. In fact, I was reading an article recently, and I found a quote from the Journal of the American Medical Association that said the following. In women of any age, statins have not been shown to exert any reduction in cardiovascular or all-cause mortality whatsoever when used for primary prevention. So once again, if somebody has known heart disease or they have a ton of risk factors, okay, that's one thing. But I saw a lady in my clinic the other day. She was 80-something years old. Her doctor had just put her on statins for the first time. She had no other risk factors, and I just feel sometimes we overuse statins, and like I say, there's a time and a place for them, but they can be fraught with a lot of downside effects too, Misti.
Yeah, what are some of the main side effects of statins?
I find the number one side effect I see with patients is just weakness, and that's most commonly expressed as muscle fatigue, especially sometimes after exertion. Guys will often tell me they just tucker out, they just can't keep going because their muscles are so tired. It can also affect things like brain fog and erectile dysfunction. You know, Misti, what happens when you take a statin, it depletes a crucial enzyme in your cells called coenzyme Q10. CoQ10 is especially important for energy production in your cells. And so it's especially the high energy cells that you find are affected by the statins. And the highest energy cells of all are your brain cells, followed by your muscle cells, including the heart's a muscle. So I do think that sometimes when people get on statins, you have those downside effects. And so you have to make sure that the upside is greater than the downside, or you probably shouldn't use it.
And you said earlier you do recommend a baby aspirin for prevention?
Well, that's a great question, Misti. I think it depends, once again, on the risk profile. If you look at when women, for instance, come in and they have low risk, I don't really recommend it that much. How about the guys? The guys, but just by being a guy, it puts them at higher risk. And I think the jury is out on that. Some people, like Andrew Weil, recommends guys over 50 should take an aspirin. But other folks, I think, are not so aggressive. There is a very slight risk of bleeds in the brain.
Yeah.
I think you have to make sure, once again, that the benefits outweigh the risk.
Well, and some people just can't tolerate anti-inflammatory
That's right.
drugs, period,
That's right.
like ibuprofen or Aleve or
That's
any
right.
of those things.
But I do think if somebody had a lot of risk factors or had a known cardiac history, I would definitely
Go
recommend
ahead.
the aspirin. Yeah, just a baby aspirin. Right.
So what about any other specific supplements for overall prevention of heart disease?
Well, yeah, and once again, I must preface this by saying I don't think these are FDA approved, but they come from my association with other cardiologists, for instance, and some wonderful books. And I'll mention one right now. It's called Heart Sense for Women by a doctor named Stephen Sinatra. Dr. Sinatra tends to be more of a holistic cardiologist, a fabulous guy, really smart, and I've enjoyed his books and lectures over the years. But he loves the coenzyme Q10, I think, is fabulous for heart, and the magnesium. In fact, I was one time I was in the ER and I listened to a cardiologist talking to a patient about their rhythm. He recommended CoQ10 and magnesium. And that wasn't rhythm on the dance floor. That was their cardiac rhythm, Misti.
And that's magnesium glycinate more.
That's right. That's right. And of course, the vitamin D can be very helpful. I think the studies tend to indicate the lower your vitamin D, the greater risk of heart attacks. I see some people come in with almost no D, and of course, Misti, we try our best to get those folks optimized.
Yeah, well, and just about everybody I hear is low in vitamin D,
Right.
even the people that are in the sun all day working on the roofs and everything.
Yeah, well, we check all our patients, and the fact of the matter is most of them are certainly not optimal. And I'll never forget a lady I saw one time. She's a big tennis player. She's got this beautiful bronze skin. She's out in the sun every day, and her D was like really low, so we had to get her pumped up for sure. I do like the fish oils. We talked about that. Niacin can be very helpful. It can certainly create some flush and those kind of things. And I like pomegranate juice as well.
Oh, yeah. Pomegranate juice is good for a lot of
That's
things.
good for almost anything, isn't it? Prostate cancer,
Exactly.
you name it. So prevention. Anyway, so Misti, we tried to give a summary of some heart disease issues today, and I hope that's to help some folks out. If you sort of do a little introspection and see if these things apply to you. If so, once again, you might want to talk to your doctor about them or get on the program. But I want to thank you so much for joining us today here on the Wellness Connection, and I want to thank you, Misti.
Oh, you're welcome.
All right, and so I hope you'll be back with us again next week. And in the meantime, check us out at McMinnClinic.com, or how can they get in touch with us on Facebook?
Just go on Facebook and type in McMinn Clinic or McMinn Birmingham, and then I'll post the anti-inflammatory diet on there one day.
Okay. All right, and if you need to call the clinic, it's 868-1313, or you can call Misti at 613-1875. So until next week, over and out from Dr. McMinn on The Wellness Connection.